Well, advanced heart failure really is when the medications and devices like defibrillators and pacemakers that we typically use stop working. When Bob came to see me, he'd had heart failure for a couple years. He'd been in and out of the hospital a couple times a year with fluid retention. And when I saw him for the first time in clinic, he was massively volume overloaded. And by that I mean because his heart was so weak, he had been retaining fluid. We directly hospitalized him. He spent about 11 days in the hospital that first time with the focus of getting rid of the fluid that he was retaining. And at this point, he was at a point where there really weren't medicines that could fix this. So eventually he had a left ventricular assist device placed, or something we call an LVAD. An LVAD is an artificial heart pump that supports the heart's pumping ability. The ultimate goal was to get to a heart transplant, but he was too sick at the moment to wait. So in putting the LVAD in, he really stabilized, he recovered. With the help of the LVAD and being on support for about 7 months, he then went on to receive a heart transplant and has done quite well since that time. Patients should come to the Ohio State Ross Heart Hospital because we offer the full spectrum of treatment for heart failure, beginning with medicines and device-based therapy like pacemakers and defibrillators, cardiac rehab, but also things like access to clinical trials. So for patients who are not doing well on their medical therapy or who may have the opportunity to be exposed to new and novel treatments that aren't yet FDA approved, we can offer a whole spectrum of clinical trial options. We have the left ventricular assist devices for patients who've failed medical therapy. And then finally, Ohio State's the only heart transplant program in Central Ohio.